Good evening. Welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. COVID-19 linked to myocarditis in college athletes reveals an MRI finding. Myocarditis, which typically occurs as a result of bacterial or viral infection, can affect the heart's rhythm and ability to pump and often leaves behind a lasting damage in the form of scarring to the heart muscle. It has been linked to as many as 20% of sudden deaths in young athletes. The COVID-19 pandemic, which has raised concerns over an increased incidence of the condition in students, athletes specifically, and it has been found that a small but significant percentage of college athletes with COVID-19 develop myocarditis, a potentially dangerous inflammation of the heart muscle that can only be seen on cardiac MRI. Number of missing teeth become the strongest predictor of mortality. A group of researchers conducted a study to determine whether oral parameters such as endodontic infections, root canal fillings, number of teeth, or even wearing removable dentures at baseline are associated with cardiovascular and even all-cause mortality in a follow-up of approximately 8 long years. According to their study that is published in the International Endodontic Journal, the number of missing teeth is considered to be the strongest predictor of mortality. Signs of professional intervention in these problems, such as root canal fillings and even removable dentures for that matter, appear to be associated with improved survival. Nebivolol has beneficial metabolic profile in diabetes and high blood pressure compared to atenolol. Blood pressure control in patients with hypertension and metabolic abnormalities is challenging as many hypertensive drugs adversely affect the metabolism. Nebivolol is a third-generation beta blocker with the highest beta-1 selectivity and nitric oxide-derived vasodilation. It has been proven that Nebivolol is beneficial over atenolol with regards to glycemic control as well as serum lipid profile in type 2 diabetes patients with concomitant hypertension. Treatment of insomnia with cognitive behavioral therapy can prevent major depression in elderly. More than 10% of the community-dwelling adults older than 60 years of age experience a major depression later in life at any particular year. Late-life depression increases the risk of health conditions such as heart disease, high blood pressure, cognitive decline, and even suicidal tendencies, particularly in men. Despite its prevalence in older adults, depression often goes undiagnosed and untreated. And even among those who receive treatment, only about 1/3 get better or even achieve remission. A new study has found that cognitive behavioral therapy prevents major depression, decreasing the likelihood of depression by over 50% as compared to sleep education therapy in adults over the age of 60, specifically suffering with insomnia. Therefore, treatment of insomnia along with prevention of depression taken together could have a huge public health implication in reducing health risks, suicidal tendencies, and cognitive decline in older adults. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.